I think it has its moments. I think a little nip in the tuck never hurt anybody. Try to get it back to where it was.
Oh, never ever. I'm very happy the way I look. People look at me, I don't need anything. No, would never.
Frank Stallone commenting there on the advent of plastic surgery in today's society. Two New Yorkers facing off on plastic surgery, our topic on our Body Basics segment today. Now, we all want to look and feel good about ourselves. Many of us are willing to go under the knife for that, but there are risks involved. And so here to walk us through the pros and cons of plastic surgery is Dr. Bruce Katz. Bruce, nice to have you with us.
Pleasure to be here. Thank you.
A lot of people,
Yeah.
well...
I just wanted to mention Dr. Katz joins us today from the Laser Skin and Aesthetic Center here in Manhattan. And sometimes it's not the knife, it's the laser these days, so we'll talk more about that too.
Absolutely.
Right?
I mean, where should one draw the line on having these types of surgeries? Everybody thinks about it, but today with the improvement technologically, it's an easier thing to do. It's less time staying in a hospital, the recovery period is much shorter. But where do you recommend patients draw the line?
Well, you know, it's clear that cosmetic surgery is exploding in this country today, but the careful surgeon selects their patients very carefully. And I think we can help a good deal of people improve their appearance. With business being so competitive today, the emphasis is on being youthful looking and having a very young appearance. So we can do really great things in that respect, but again, we want to be careful so that we don't make the person worse as a result of the surgery and not better.
Which is part of what we're going to focus on today, scarring that can sometimes result in the like. But you know, Dr. Katz, you talk about this cult of cosmetic surgery, which really has grown up, and more to the point of how do you draw the line. Some people do it for frivolous reasons, would you say?
Well, I think some people do come in and they have unrealistic expectations. Someone might want to have some wrinkles removed around their eyes or around their mouth, or get more hair on the head with a hair transplant. And when you speak to them and understand them psychologically, you realize that they really want to have a better sex life, family life, or a better job, and they think the surgery is going to achieve that. And that's unrealistic, and those types of people we don't really feel are appropriate candidates for cosmetic surgery.
Do you turn people down?
We certainly do. We probably turn down 20 to 30% of the patients who come to our center.
Do you really?
And what sorts of things are you hearing from those people that would cause you to reject them as a patient? I mean, is it because of the things you just discussed with Carol, that they're doing it for the wrong reasons, or they're a medical risk? I mean, what types of factors come into play?
Well, it's, I think, more often the case that they're doing it for the wrong reasons. If someone has medical risks, obviously we want to avoid surgery there, but that's actually very infrequent. It's more often a problem that someone wants to have an improved appearance, but for the wrong reasons. They think that their improved appearance will help their personal lives, and they're not going to be happy. And as surgeons, we don't want to do surgery on someone who is not going to be happy with the result, because we're not treating the underlying problem, which is their psychological issue.
Right. Right.
Yeah, I was going to say the most popular procedures now. What do folks most often come in for?
Well, laser surgery has become very popular. We can take away wrinkles now with the laser, and take away scarring, sun damage. Hair transplants have really been revolutionized, and with the mini and micrographs, we can make hair transplants look completely natural, almost in efficacy, and people can't detect hair transplants. We do chemical peels now, superficial chemical peels, when someone can go right back to work after this procedure and take away sun damage and precancers, and hopefully prevent skin cancer in the future.
Is that done with the laser usually now? The chemical peeling? Well, the chemical peeling is a chemical, but I think there's something else happening now with lasers that can even replace that, I was reading.
Yeah, we can use lasers to take away sun damage, but there's some downtime involved. With these new, the pulse peel, for example, we can treat someone, take away their precancers, and hopefully prevent skin cancer without any downtime at all. They can go right back to the office the same day. So the improvements have been considerable.
In terms of the people, I mean, someone might select to have a particular type of surgery. It's successful, they're incredibly pleased with their new appearance. How much of your business is repeat customers?
Well, I think when people are selected properly, very few people have to have repeat work. I'd say it's
I'm sorry, I didn't make that clear. I didn't mean in terms of having the same procedure done again, but in terms of having one procedure done, then deciding, boy, this worked out well. Let's have something else that I've thought about, you know, having taken care of.
That actually is quite common. Someone may come in to have the wrinkles removed, and then they realize they really are happy with the result, and they want to have liposuction, so they come back to our center for a liposuction procedure. Or one fellow comes in, had a light chemical peel, the pulse peel, to take away precancers, and he realizes he looks really good. Now he wants more hair, so we do hair transplants. I think that often is very a common occurrence.
Yeah,
in
but
fact.
the most popular procedure, is it the facelift itself or the eye lift, or?
Well, it's quite equal, I would say. Some people come in because of acne scarring and want to improve their appearance with a laser treatment of acne scarring. Other people come in because they want to have the wrinkles removed. That's very popular too.
Yeah,
I think with men, hair transplants are quite popular, but men's cosmetic surgery has been improving greatly. A lot of gentlemen feel that they want to look young too. It's not just women's purview anymore. And they want to have the chemical peels, the laser resurfacing, take away the wrinkles. Because in business, they want to look young, feel young,
Vital and the
and
like,
cosmetic
yeah.
surgery can do that.
So the stigma seems to be
Fading.
lessening, fading
very
like a
rapidly.
wrinkle.
Yes,
Yeah, that's what
right.
you know. Why don't
Exactly.
we're going to take a short break. I know we want to talk a little more about the costs of some of these procedures, but we're also going to talk about, very importantly, how many people find that they are scarring after these procedures and what can be done about that. That's part of Dr. Katz's specialty. So stay with us on Money, Style, and Power.
Hello, I'm Mercedes Woods.
I'm Tony Guida. Coming up Wednesday on the S+